You're listening to Not Another Depressed Teen, your guide to mental health in teens by teens, for parents and kids. From learning effective communication to finding the right resources to help your child prosper, our podcast has all the tools you need to gain insight on how to improve your mental health and your child's. Stay tuned to learn more.
Hi, my name is Pranjal.
And this is Anya. So today we're going to be discussing what is mental health with Leticia Velazco. Mrs. Velazco is a school counselor at Irvington High School in Fremont, California, and has worked in education for over 25 years. She's been actively involved in student support systems such as SST, Student Study Team, COST, Coordination of Services Team, and SEL, Socio-Emotional Learning Reengagement.
Thank you so much for joining us, Mrs. Velasco. Is there anything you'd like to say about yourself or mental health before we get started?
Yeah, well, first of all, thank you for inviting me. It's an honor to be here. So thank you to you, Pranjal and Anya. This is an important topic. So again, thank you for having this opportunity to discuss it and welcome the conversation. Thank you for having me, for having invited me.
Yeah, of course.
So when you think of mental health, what comes to mind for you?
So mental health is part of a bigger picture. It's as important, and well, physical health, of course, we can all see physical health, and we can all relate to physical health in terms of sleeping well, nutrition, exercise. Some will argue that mental health is even more important than physical health, because the mental health affects our attitude, it affects our motivation level, it affects our optimism level, and our energy and concentration levels. So mental health is just as important as physical health, and it impacts every arena of our life, and it affects young people as well as middle-aged people, as well as the elderly. Is something that we need to take care of on an ongoing basis.
Definitely. I think that for me, when I think of mental health, what kind of comes to mind is also like the way certain people and individuals respond to stressors in their life. For example, like many people can be put into a challenging situation at school or otherwise in their life. And, someone who had good mental health will be able to respond to those stressors in a healthier way than someone whose mental health is kind of declining or at a low point.
Yeah, absolutely. The mental health can be tied in with how we look at challenge. It could be looked at as an impossible task, and I feel at the onset, if something goes wrong, I feel defeated. Or it could be looked at, oh, I'm going to learn from this. And if I make a mistake, that's even better, because I'm going to learn from my mistakes and have a growth mindset versus a fixed mindset. So the challenge can absolutely be seen as, okay, this is something new. This is like, I'm going to learn, I'm going to ask questions, I'm going to make mistakes, and it's okay to make mistakes. So that is a different mindset. So you're right. A challenge can be looked at a very different way depending on someone's mental health.
Yeah, I really liked your point about like fixed and growth mindset, right? So if I'm correct, fixed mindset is kind of the idea that things are the way they are. They're static. It's hard for me to change. Whereas growth mindset is I can change. I can work hard and change myself and my circumstances. Correct?
Absolutely. Absolutely. And it's really important that we as adults and parents demonstrate that to our children as well as our students, where it's okay to say, oh, I made a mistake and we're going to get through this together and I'm going to learn, and show that to our children and our students in whatever setting that is, that it's okay. Like we're lifelong learners. We don't have all the answers, even if we're adults and parents, and that's okay. We're learning as well as our children are learning.
Yeah, that's a good point. So like not punishing ourselves and not punishing others for mistakes, but like embracing them as a chance to learn.
Absolutely.
And do you think of mental health as like a personality trait, like something a person just has, or is it like a temporary state of mind? Is it fixed? Is it a range? Or is it just like something, do people just make up labels like depression when they're just feeling a little sad? Well,
mental health is broad, but I think it's a very good thing that we are more open to talking about it. I believe like maybe 20, 30 years ago, and definitely still in certain families, mental health is just not talked about. So for example, if someone breaks their arm, they go to the doctor, they get x-rays, they get seen, they have to have a cast, or if they break their leg, they wear crutches. I think with mental health, because it's something that's not seen from the outside, definitely it could be observed, and we could talk a little bit about that, but it's not seen as, oh, you're dealing with a mental health challenge, let's go see the right person, the expert that will help deal with that. So those conversations haven't been happening in the past. Slowly, we're seeing that it's becoming more open, and it's okay to talk to your children and say, hey, what's going on? And if your child is saying, this is what I'm feeling anxious, or I'm feeling like it's really hard for me to get motivated, or I'm really having a really hard time dealing with these thoughts. It's important as us as parents to see that, hear that, and take the right steps to help address that. So again, it's definitely, mental health is tied in with our human nature. And those conversations, the more open they are, the healthier it is, because it's just as important to us as eating well, sleeping well, is having that state of mind that is also positive and optimal.
Yeah, I think it's really important to have open conversations because, like, any problem in life, right? Ignoring it isn't going to make it go away. You have to talk about it in order to find solutions.
Correct. Absolutely.
I definitely think it's kind of like a range, or not something that's like black and white, as like a lot of people, parents a lot of times can be scared with like things like labels. Your kid seems to have depression, and they get really scared because they think it's your kid's well, your kid's unwell. But really, like, as much as we love to label people as mentally healthy or mentally ill, how do we actually decide who fits into each label? And do you think these labels do like harm? Do you think they do good? What are your thoughts on labeling people based on their mental health?
People are complex, and everyone will experience times of sadness. Everyone will experience times of great joy. Everyone's going to deal with stress at one time or the other. Everyone's going to deal with loneliness. The labels are, we need to be careful, right? Because one, depression is a medical condition, and that needs to be diagnosed by an expert, a physician, a psychologist, a psychiatrist. Same with anxiety. That anxiety can trigger, for example, more severe mental health issues, but a little bit of anxiety is also okay, because we all need a little bit of stress, a little bit of anxiety. There's also healthy stress, right? There could be a healthy amount or dose of anxiety that will help move us forward. For example, if there's a due date coming up for a project, we need a little bit of stress or anxiety sometimes, just to kind of get that, get the project done. Again, it's a healthy stress, right? If it becomes to the point where the stress and anxiety is debilitating and it's counterproductive, and then it's leading to your child, your student is giving up, then okay, we need to examine that. We need to be seen by an expert. So we can't label people. That's a medical diagnosis. So we have to be careful about labeling. And we need to refer people to the right specialists when it comes to saying when someone is depressed, or someone, has a substance abuse issue, or is dealing with a trauma. We need to refer people to the right experts that it's going to help them overcome those challenges.
Definitely, yeah. I think that like it's important to also like, while labels are like very serious and like they should only be like given by a mental health professional and like should be taken seriously, it's also important not to be terrified of them, because in my experience I've seen a lot of parents and a lot of people, they get this label as, oh, like, seem to have this illness, and it just really scares people. Mm-hmm. Even if you do have a mental illness, those things aren't a fixated part of you, or like it's not like your personality is depressed. it's something that is happening to you. It's a mental state you're going through, and it's something that can be overcome. Even if you have this label, that's not forever, and it doesn't define who you are.
Absolutely. For example, like someone can have diabetes, and what they're learning to do with seeking the right medical attention is learning how to manage diabetes. So depression is the same thing. It's a medical condition that could be definitely be treated. And the more self-aware that person is, the more they can manage depression. And so you're right. People shouldn't be scared of those conditions, depression, and that comes with education. The more a parent is educated about what really is a mental health illness, the less scary it is. So I believe strongly in the education piece, because if it's talked about, if someone is educated about it, then it becomes less scary. And they come to realize, oh, okay, well, that could be treated and that could be managed. And I know the signs and I know to be aware. And that's also going to help me support my child. So the more I'm aware as a parent of what is depression, for example, the more I can support my child and be aware of what they're going through, helping them monitor, having those open conversations. So that's really, education is an important piece.
Yeah, I agree. And I think education of parents is so important because at the end of the day, children still need their parents' support to accomplish things, right? They need
Absolutely
that backing up. And if a parent has a child who gets like some kind of injury, right? They're probably going to do some research. They're going to go on the internet. They might read a book. They might spend some time understanding what's going on, talking to a couple different experts. And it's really the same way for mental health, right? There's lots of resources online. There's some resources on notanotherdepressedteen.com. So it's a chance for parents to learn more before they can figure out how to help their kid. Because there is a way. It's just not always easy or obvious at first.
And so I would recommend if any family member is dealing with a mental health challenge, that the whole family, the parents, the siblings, all get there's support groups out there. There's workshops. Like you said, there's books, there's a lot online, and it will bring the family together when they all support one individual.
Yeah, and I think it should be acknowledged how difficult it is to have a family member who's, suffering through some kind of mental illness, who isn't like where you want to be emotionally. It's hard to see someone you love go through that, but hard doesn't mean it has to like break your relationship, right? It can be something difficult that you face together.
It's an ongoing learning process, and it will only just help and strengthen everyone else the more knowledgeable they are about this mental health challenge.
Yeah, I agree. I think knowledge is our biggest power. I think part of the thing that happens with parents is a lot of times when kids first tell them that like, hey, I want to see a psychologist. I think I have anxiety, or I think I have an eating disorder, or something like that. A lot of times parents' response is like, well, I didn't raise a child with this issue. Like, you were fine when you were born. So do you think everyone is born the same? Or do you think like as you grow older, your mental health changes due to like internal and external factors? Why do you think that, some kids face these issues while other kids don't?
There's a lot of factors. There could be a genetic predisposition. There could be traumatic event. There could be just regular life stressors that cause the onset of a mental health challenge. And it could happen at any age. We're seeing more and more elementary school students showing signs of a lot of mental health support. And then in college as well, you see, unfortunately, the suicide rates in college are really high. And it's sad because that person was reaching out for help, right? And it's one of those things that you just kind of you would never want that for anybody. And so the more education there is, the more we can kind of support everyone. And so, to answer your question, it's hard to tell what starts it, but we know it's there. And I think a lot of social factors are also contributing factors for students. There's a lot of academic stress, and that didn't come from them internally, right? That came from social factors outside, where there's a lot of pressure to do well in school, to get into certain colleges, to get a certain GPA. And that in itself, in addition to kind of just going through adolescence, dealing with getting, knowing, developing a strong peer support network, and, family, peers, the academic piece, all that together can be overwhelming for a lot of students. So I think there's a combination. We're talking about a combination of things. And again, this could happen to anyone from elementary school age to someone in their 70s. And so this is something that we all need to be aware of and be educated about.
Yeah, I agree. I think that also it's not necessarily important trying to figure out why or when. It's more important to accept it and try to like move forward and work together to help, whoever's struggling feel better.
Yeah,
Absolutely.
a lot of times I've seen like parents when they realize that like their kid has a mental illness or is like struggling emotionally, they go for the why, they panic, they feel like it's my fault, what did I do wrong? But really it's like it's not about as difficult as it is for parents and for the people around the mentally ill like individual. Like it is extremely difficult for that individual as well, and like it's more important to focus on their feelings and how to fix those things rather than focusing on the big why, which can basically be like this huge array of things that you'll never really get an answer for.
Right. And everyone is different. I mean, we talked a little bit about, triggering factors. For one person, it could be, for example, a breakup, and that could cause a whole different, like a range of different emotions and feelings, and that are new to that person. For another person, it could be an academic situation. For others, it could be, maybe a family situation. And for some, for no reason at all, they just feel a certain way. And so it's really hard to kind of figure out what started it, what's the onset. But you're right. It's more important to focus on, okay, this is what we're dealing with. What do we need to do to support you? That's the number one thing. What do we need to do? What do you need? What do I need to do to support you? What can we do at home? What can we do at school? What can we do as a family? What can we do as a community to support you?
Yeah, I agree. And I really like your point about how people are different. So something that might not be a big deal to you might be traumatizing for another person, right? Like I saw something online and it was like people can drown in 10 feet of water or people can drown in 100 feet of water, right? It's still difficult, and we need to validate that they're struggling.
Correct. Yeah. And that's exactly right. We need to validate people's feelings wherever they're at. And for whatever reason that brought them there, our job is not to judge, is to support you, right? Because everyone is going to have a different experience and different reaction to things. And that's not for us to judge. It's more like, okay, what do we do to help you? And moving on, how do we manage stress in positive ways? So again, it's a growth opportunity.
Yeah. So how changeable do you think a person's mental health actually is? Like, who can change their mental health? How can someone change it?
A lot of it is someone can if someone is determined to change their own outlook on life, that's something that they can do. They can read books, they can meditate, they can surround themselves with positive, like-minded people, they can seek resources, they can change themselves. For other people, it might be a little bit more difficult. So they might need to get outside support to help them have a better outlook, to have a stronger mental health, to learn positive coping mechanisms, like healthy coping mechanisms. So everyone's going to be a little bit different on if someone like on that goal of changing their mental health status, but it could definitely be done. Because we are all growing, intelligent people. We can all learn. This can be learned behavior. So regardless of someone's circumstances, this is a learned behavior. And so again, the process is going to look a little bit different for everybody, but we can all, if that's our goal, for example, if someone's goal is to do 30 minutes of exercise a day because that's the goal that they set for themselves, that's good for them, that's manageable, that's healthy for them, that's something that they can be done. Same with mental health. If someone's goal is, okay, I'm going to do this for my mental health, whether that means I'm going to take a walk, I am going to hang out with my best friend, I'm going to read my favorite book, and this is a way for me to take care of myself, then that could be accomplished. So that process is going to look a little bit different, but definitely that's something that we can all do is improve our mental health.
Yeah, and I know for people who have like depression, anxiety, or like other similar problems, it can be really hard for them to find the motivation to go for a walk or to make those changes. And that's where like family and like friends support comes in. But at the end of the day, whoever is struggling, they need to make the action, right? Like no one can move your legs and force you to go outside for you. At the end of the day, like you have to do it yourself.
Right. And that person might need a little support, right, to get to that point. And that's where their support system comes in, right? Like the friend that invites them to go, let's go do this together, right? Or the parent that says, hey, stop what you're doing. We're going to just go on a car drive and we're just going to enjoy being together. It could be someone at school, that favorite teacher, counselor, or librarian, or whoever is that person in school that just will listen. And sometimes that's all it takes. Like, I just need someone to listen to me. And then I can take the next step to help improve my mental health. So again, that process is going to look a little bit different. And that go-to person is going to look a little bit different too for everybody.
I really like your point about listening, because I feel like a lot of times people, especially parents, they get into this like solution, advice mindset. But sometimes the best thing that you can do is just be a listening ear and a non-judgmental person, because people want to open up and talk about their struggles, but they're afraid of the stigma and all of those other things that come with mental health.
Yes. And I'm a parent, so I know it's very difficult. It's more difficult to listen than to talk. But I think if we as parents can learn to listen, it invites our child to open up more. And I'm not solving it for them. I am letting them solve it themselves. And that helps with their self-empowerment. I don't need to provide the answers. If they ask for advice or recommendations, let's talk about it. Especially young adolescents, like high school age. Sometimes they just don't want the answer. They want to figure it out themselves. And actually, it's healthy to figure it out themselves. That's how they learn. And if they make a mistake, that's okay. That's how we all learn. So you're right. As parents, we need to do a better job of listening, not giving advice, not giving answers, not giving solutions, but letting our kids figure it out. And that's how they learn and that's how they grow. And it's okay to make mistakes. This is the time of your life to just make mistakes, because this is part of adolescence.
In my own personal experiences with mental health, I found that a lot of times people, when you try to open up to someone about how you're feeling, people come to you with a sense of trying to save you or trying to provide these solutions for you. And a lot of times that can just frustrate someone further, because there isn't one solution that someone can give you. There isn't something that will 100% turn things around. And sometimes you just need someone to listen and someone to acknowledge that what you're going through is difficult. And it takes a lot of effort to move out of that state of mind and improve your own mental health.
Yeah. I also think it takes a lot of courage for someone to open up, because that's very personal. And when they open up, that's like an opportunity. They're opening part of themselves. So again, we as parents, if our child is talking to us about their feelings, their thoughts, their worries, their goals, we need to just stop. We need to stop talking and we need to just listen because otherwise, you know what? They're not going to talk to us again. And we're missing a really golden opportunity to just be there. And sometimes for a lot of young people, that's all they need. It's just, we need to be there. So we as parents have to do a better job of just actively listening, put away that phone, stop cooking, put away that laptop, and just be there. And that's how we demonstrate our love for that for our child is just be there. So yes, we can definitely do a better job of doing that.
Yeah, I agree. One of the things about mental health, though, is a lot of parents think it's some kind of trend, which in some ways I definitely wouldn't call it a trend, but it is concerning how much mental illnesses have increased over the past years. And I have a statistic here. It's according to Pew Research, and it says the total number of teenagers who recently experienced depression increased by 59% between 2007 and 2017. Do you think this drastic increase is due to more diagnoses available, or is it like people reading about it more on like social media and books and television, or do you think mental illnesses are actually becoming more prevalent in youth?
I think it's a combination of both, because before there could have been just as many cases, just people were just like, deal with it. and we there was no like way to kind of address it in a more holistic way. At the same time, just from my perspective, the academic stress that wasn't there before, maybe, 20, 30 years ago. And the academic stress also is taking a huge toll on students' mental health. Just the sheer amount of workload also, I think is a big factor in these high numbers of students getting depressed, because it becomes unmanageable. And then what happens is there's no longer a healthy balance. There's just so much done at a certain time that it becomes unmanageable. And then, of course, if something doesn't go right, then sometimes it can cause discouragement, and then it can cause anxiety. So that can have like a spiral effect. So I think to counteract some of these numbers, I think one, continuing having these open conversations. Two, we need to talk about big picture, like what's important, and talk about priorities in our society for our young people. I mean, what's more important, is grades or making sure that they have enough sleep? Is it where they go to college, or how they feel about themselves? How many AP classes they take? Or does this student generally involved in things that are important to them, like whether it be the theater program, whether it be a sport, whether it be learning about astronomy? Like how much, where are our priorities in society, and what are we doing? Why is some priorities more important than others in our society, which is causing some of this anxiety and stress among young people? So I think as a society and a community, we have to ask ourselves, what are we doing to contribute to these high numbers of young people with depression? And so I think we have to have an honest look at what are we doing to perpetuate this, and we need to stop, because it's not good and it's not healthy for anybody.
Definitely.
And I really like your point about academic stress contributing to these problems, because I'm a high schooler, so I agree there is a lot of pressure from schools, and of course it's important to reassess our priorities. But do you also think that schools have a responsibility of controlling how much homework is given and how much pressure the curriculum puts on kids?
Absolutely. Schools have a incredible responsibility. It's all, again, this is all part of the conversations, because, just to give you an example, it's really hard to put limits on how many AP classes a student takes, because the demand is there. So how do you limit AP classes when the demand is very high? As I think it's a partnership between the schools, between parents, between students, between colleges. There's got to be these conversations about let's take a look at the big picture, look at what's happening, and what do we need to do as a school, as parents, as colleges, as employers, to help mitigate these numbers of students who are dealing with depression and anxiety and, like you said, eating disorders, substance abuse, and what we need to as a community. So of course, the school plays a huge role, but then I think also those conversations with the parents and with all these other outside forces and institutions to have a more balanced approach and more health focus on young people, to make sure that this is all done in a way that's healthy for young people, and again helps to address that statistic that you shared about the number of students who are dealing with depression and mental health issues.
Definitely. So I think for people listening to this right now, or like anyone who's thinking about the way mental health is affecting them, their families, their communities, one of the most important things that we all have to do is talk about and have these like open discussions about what is mental health to you personally? What is mental health? How is it affecting you and your family and the people directly around you?
Yeah, and I think a great way to start talking about it is, of course, with friends and family, but also if anyone listening has anything they'd like to hear us discuss on the podcast, they can email us at notanotherdepressedteen@gmail.com or go to the website notanotherdepressedteen.com, and there's a little question box there so people can put in any questions or topics they'd like to see. Thank you so much for listening to Not Another Depressed Teen. Make sure to check out our website, notanotherdepressedteen.com, if you have any questions or comments, and also take a look at our Instagram and Facebook. See you next time.